Hi everyone. I chose schizophrenia as my topic because it is such a complex disorder and I thought the treatments would be interesting to learn about. So let's talk about schizophrenia. So what is it? The definition of schizophrenia is a mental disorder that affects someone's thoughts, emotions, perception, and behaviors. Some also describe it as a loss of reality. As you can see in this picture, this guy is running because he hears someone telling him to run from something that is going to get him. He also hears people asking him why he is running and calling him stupid. All the speech bubbles are the same because a person with schizophrenia has a hard time distinguishing reality versus delusion. There are three categories of symptoms. Positive symptoms are characterized by psychotic behaviors. These include hallucinations, delusions, movement disorders, and a dysfunctional way of thinking. Negative symptoms are characterized by disruptions to a person's emotions and behaviors. This could include reduced facial expressions or tone of voice, reduced feelings of pleasure, and it can also be challenging for a person to start or continue certain activities. Cognitive symptoms are characterized by changes in memory and thinking. These symptoms could be poor decision-making and executive functioning, difficulty focusing, and problems with working memory, which is commonly known as short-term memory storage. I chose this image because it also included mood symptoms, which I think must have been recently acknowledged as a category for schizophrenia symptoms. These are lack of motivation, social isolation, and possible suicidal thoughts or attempts. Some of the early signs of schizophrenia involve depression or social withdrawal. So if someone is acting very withdrawn or not wanting to participate in normal activities, this may be the first sign of schizophrenia. Some may act very paranoid or suspicious of others. This paranoia could be due to things that we cannot see, but they believe it is there. If you witness this type of paranoia on more than one occasion, it would be good to seek help for that person. They may also make irrational statements. This could include laughing or crying at inappropriate times and extreme reactions to criticism. These people may find it hard to concentrate or remember things, and they may also oversleep or not sleep at all due to insomnia. Now that we know a general idea of what schizophrenia looks like, I am going to talk about the biochemistry behind the disorder. Scientists believe schizophrenia patients have an overactivity of dopamine or serotonin that causes their symptoms. This slide depicts the theory behind how dopamine may be causing schizophrenia. The evidence that shows excess dopamine is resulting in schizophrenic symptoms are drug agonists and antagonists. Most antipsychotic drugs somehow block D2 receptors in the brain. On this image, they use chlorpromazine, which I will call thorazine in my slides as an example. Thorazine combats the symptoms of schizophrenia by occupying the binding site of dopamine on D2 receptors. This would be a competitive antagonist since it occupies the dopamine binding site. On the contrary, agonists of the dopamine transmission has shown schizophrenic-like symptoms. The two examples of agonists in this picture are amphetamine and cocaine. Both of these drugs block reuptake of dopamine, leaving dopamine in the synaptic cleft longer to bind to more receptors. This slide is depicting an ideal how we can use the dopamine hypothesis to come up with a treatment for schizophrenia that will help both positive and negative symptoms. In schizophrenia patients, negative symptoms and cognitive symptoms come from low dopamine release in the mesocortical pathway. This means dopamine is not activating the prefrontal cortex, which is causing a decrease in motivation, emotional expression, and working memory capacity. Ideally, a treatment or drug would increase the activation of the mesocortical pathway to combat the negative symptoms of schizophrenia. On the other hand, we also need a drug that will slow down the dopamine activity in the mesolimbic pathway. Schizophrenia patients have excess dopamine release to the nucleus accumbens, which is causing the positive symptoms such as hallucinations or delusions. This image is proposing that we need a treatment that can both block dopamine in the mesolimbic pathway while also activating the mesocortical pathway to treat both positive and negative symptoms. So now it's time to talk about some of the treatments for schizophrenia and the neuroscience behind these treatment options. There are so many drugs to treat schizophrenia that I decided to pick 4 of the most common ones. These are Seroquel, risperidone, thorazine, and clozapine. Seroquel, also known as quetiapine, is an antipsychotic medication. It's classified under a second-generation antipsychotic or an atypical antipsychotic because they are dopamine and serotonin antagonists. Typical antipsychotics were made in the 1950s. These are still effective today, but because of the severe side effects they may cause, they developed atypical antipsychotics in the 1990s. Atypical drugs are shown to be much safer and have a lower risk for side effects. There are two types of Seroquel pills, immediate-release tablets or extended-release tablets. This just means that one releases the drug immediately after taking the drug, and one takes longer to be released into the system. Seroquel should be taken every day, and depending on the person, it can be once, twice, or even 3 times a day. Doctors usually start patients off with a small dose and build up to higher doses. On average, schizophrenia symptoms like hallucinations and lack of motivation will improve after 1 to 2 weeks of taking Seroquel. Some symptoms may improve but never completely go away. This drug has also been used to treat bipolar episodes and symptoms of major depressive disorder. The reason this drug is used to treat schizophrenia is because it rebalances dopamine and serotonin in the brain. The drug should help their mood and thinking and behavior. Risperidone is commonly known as risperidol. It is very similar to Seroquel because it is also a second-generation antipsychotic and rebalances dopamine and serotonin in the brain. Scientists are not sure exactly how it affects these neurotransmitters, but they strongly suspect that it reduces or even blocks transmission of serotonin or dopamine. This drug works because individuals with schizophrenia have high amounts of these neurotransmitters which result in their symptoms. Risperidone can be taken orally with a pill or injected in a liquid form. This drug is fast-acting, but it may take several weeks before the patient feels the full effects. Risperidone also is used to treat bipolar disorder episodes and irritability in children with autism. Although not officially approved, it can also treat Tourette syndrome and sometimes anxiety. Thorazine, or chlorpromazine as some call it, is a phenothiazine antipsychotic. This drug helps you to think more clearly, decreases anxiety, aggression, and thoughts of self-harm. It also helps decrease hallucinations in schizophrenic patients. This drug is also used to help other mood disorders and psychotic disorders. Short-term uses for thorazine would be to help reduce vomiting, anxiousness before a surgery, or even treat tetanus. This drug is also taken orally every day, either 2 or 4 times a day. It is highly recommended not to stop taking this drug without talking to your doctor first. Symptoms could worsen, or other symptoms such as dizziness, shaking, upset stomach could arise from stopping thorazine. Clozapine is also a second-generation antipsychotic or atypical antipsychotic. It is taken orally by pill or liquid. Clozapine is prescribed for only schizophrenic patients or depressive disorders that have led to self-harm or suicidal attempts. This medication is also prescribed to schizophrenia patients who have not improved with any other prescribed drugs. Clozapine should be taken every day. It should start showing full effects after 2 weeks when the target dose is reached. Some may need higher doses to see any change.